Hello everyone. Today we're going to talk about the cranial cavity. So as you can see, the calvaria is removed and you can look into the cranial cavity. The cranial cavity is clearly divided in three cranial fossa. You can see there is an anterior cranial fossa, we have this middle cranial fossa, and then we got this posterior cranial fossa. And thankfully, unlike the base of skull, we don't need any imaginary line to divide the cranial fossa. We have these clear-cut margins. Like this is the lesser wing of this sphenoid here, which is separating the anterior cranial fossa from the middle. And this here is a petrous part of temporal bone. You can see this here. This is the petrous part of temporal bone, especially the upper border of the petrous part, which is separating the middle cranial fossa from the posterior. So let's discuss all these three cranial fossa one by one, and we'll talk about the important foramina there and also the attachments to the particular bony projections present in that cranial fossa. So let's start our discussion with the anterior cranial fossa. Now first of all, let's find out that what are the bones which are contributing to the formation of anterior cranial fossa. So there are mainly three bones. You can see one, this is the frontal bone only. So the frontal bone is forming the roof of the orbit, and that is why we call it the orbital plate of the frontal bone, which is forming the major chunk of this anterior cranial fossa. Then in the middle part, where I'm pointing right now, this is the projection from the ethmoid bone. We call it a cribriform plate. That sieve-like plate that you see here, that is a cribriform plate, and this cribriform plate actually separates the cranial cavity, or you can say the anterior cranial fossa, to the nasal cavity. Third contribution comes from a part of the sphenoid bone. Now this, if I may mark here, this is the lesser wing of the sphenoid. Just running in pencil in here, this is the lesser wing of the sphenoid. So this portion, which is the lesser wing of the sphenoid, is a third contribution in the floor of the anterior cranial fossa. So I quickly go through this again. We said we have three bones in the anterior cranial fossa. We have this frontal process of the, this is the orbital process of the frontal bone, sorry. Then we have cribriform plate, which is a contribution from the ethmoid bone. And then we have the lesser wing of the sphenoid. It's a part of the sphenoid bone which is forming the most posterior part of anterior cranial fossa. Now let's talk about the particular features in this anterior cranial fossa. In the anterior-most part of the cribriform plate, now you can see a foramen present here. Now this foramen, which is behind this frontal crest, is called as foramen cecum. As the name goes, the cecum is for the blind, so this foramen usually is blind and is not giving passage to any structure. But in like 1% of population, it may be patent and giving passage to nasal emissary vein. So as I said, it is blocked, it is not open into the nasal cavity, but in some cases it can be seen opening into nasal cavity and giving passage to nasal emissary vein. Just behind this foramen cecum, in the center of this cribriform plate, we have this Cox comb-like projection, which is called as crista galli. You can see it better if I turn the skull slightly onto the side. And look at this projection here. This triangular projection, this is called as crista galli. The crista galli. This frontal crest as well as the crista galli, they both are, this is the frontal crest, right? Cribriform plate, as I said, the meaning of cribriform is sieve-like. So it is like a sieve-like plate. We have so many openings to be seen inside, and these are giving passage to the olfactory nerve rootlets. So we actually do not have a olfactory nerve like a typical nerve. We have all those rootlets which are coming out of this cribriform plate, and they directly goes into the olfactory bulb. If I come behind this cribriform plate, now this center part, if you see, this is called as the jugum sphenoide. We call it jugum sphenoide, and this is the one which separates the anterior cranial fossa from this sphenoidal air sinus which is present deep to it. So that is called as the jugum sphenoide. and that is separating the sphenoidal layer sinus to the anterior cranial fossa. As we already said, this is the lesser wing of the sphenoid. Now, if you look at these projections of the lesser wing of the sphenoid, these projections are called as anterior clinoid process. These are the anterior clinoid process. And these anterior clinoid process, they give attachment to the free margin of the tentorium cerebelli. They give attachment to the free margin of tentorium cerebelli. Tentorium cerebelli is a dural fold only which separates the occipital lobe of the cerebrum to the cerebellum. So which will be present in this region. It is present in the posterior cranial fossa, but the free margin of the tentorium cerebelli is attached to this anterior clinoid process. And therefore we have a notch present in between called as tentorial notch for the passage of the brainstem. The brainstem can descend downward through that tentorial notch which is present inside the free margin of tentorium cerebelli. This posterior margin of the lesser wing of the sphenoid, it fits exactly in the lateral sulcus, in the stem of the lateral sulcus of the cerebrum. I mean, frontal lobe of the cerebrum will be here and the temporal lobe will be in this middle cranial fossa. And I hope you know on the inferior surface of the cerebrum, the sulcus which begins is a lateral sulcus. So the stem of the lateral sulcus, it fits in this posterior margin of lesser wing of sphenoid. So if I go very precisely about that, what is separating the anterior and the middle cranial fossa? So I can say this is the posterior margin of the lesser wing of the sphenoid, the anterior clinoid process, this one. And then we have this sulcus. Now look at this sulcus, guys. This is called as chiasmatic sulcus. When the optic nerve will come out from here, so we have a sulcus in front of it. So we call it chiasmatic sulcus in there. Free margin of lesser wing of sphenoid, anterior clinoid process, and this chiasmaticus sulcus or sulcus chiasmaticus, whatever you call it. That is the one which separates the anterior and the middle cranial fossa. Okay, now let's talk about the middle cranial fossa. Let me just again justify the boundaries of the middle cranial fossa. So we said the posterior margin of the lesser wing of the sphenoid. Then we have this chiasmaticus sulcus or sulcus chiasmaticus. So that is an anterior clinoid process. So these are the three things that we have forming the anterior margin of middle cranial fossa. Posterior margin is by the superior border of this petrous temporal bone, and then by this dorsum sellae. We will talk more about this dorsum sellae in a while. This is a dorsum sellae part which is behind sella turcica. So once again, first let's see what are the bones which are contributing to the middle cranial fossa. So guys, in the middle, obviously again we have the sphenoid bone which we saw is contributing in the anterior cranial fossa also. So this is the body of the sphenoid in this region. Then on the side you can see the greater wing of sphenoid. Now this was the lesser wing of the sphenoid. Now this here is the greater wing of the sphenoid. It looks like a wing of a butterfly only, so we call it a greater wing of sphenoid. You can see a demarcation also here which is separating it from the temporal bone. So we got a greater wing of sphenoid. We got this body of the sphenoid here. We have the squamous part of the temporal bone. This is the squamous part of temporal bone here. And this one is the petrous part of temporal bone. The stony part or the bony part. This is the petrous part of the temporal bone. Okay, let's start from the middle part itself. So just inferior medial to these anterior clinoid process, you can see this opening, that is optic canal. Just inferior medial to anterior clinoid process. We got this optic canal giving, obviously leading into the orbit, and it gives passage to optic nerve and ophthalmic artery. Then we have this elevation in this region, and this elevation is called as tuberculum sellae. This is called as tuberculum sellae, which is separating the sulcus chiasmaticus from this pituitary fossa or so-called sella turcica. So this tubercle is the one I'm pointing at. This one is called as tuberculum sellae. So tuberculum sellae is separating the pre-chiasmatic sulcus or optic groove, or also called as this sulcus chiasmaticus, or different names, to the sella turcica. The sella turcica, which is lodging the pituitary gland, and then behind we have this projection called as dorsum sellae. This margin of the dorsum sellae and this tubercle, they are giving attachment to the diaphragma sellae. The diaphragma sellae is the one which separates the pituitary gland from the diencephalon. So we have the pituitary gland present here, and it is covered with a dura mater above, through which the stalk of the pituitary gland will pass. That is called as a diaphragma sellae. Let's move more toward the lateral part of this middle cranial fossa. Now, as we already said, in the lateral part, we can see the petrous part of the temporal bone, we have the squamous part of temporal bone, and we got greater wing of sphenoid. Now, let me just tilt this skull for you a bit so that you can see that just inferior lateral to the anterior clinoid process, you can see fissure, that is a superior orbital fissure there. I can see these are the superior orbital fissure. We'll talk more about the superior orbital fissure from the orbit side. So I just notice those superior orbital fissure which are present just inferior lateral to anterior clinoid process. And then in the greater wing of this sphenoid, these three foramen can very well be appreciated. This is the foramen rotundum, which is oriented more anteriorly, giving passage to the maxillary nerve. Then we got this foramen ovale, which is just posterior lateral to the foramen rotundum, that is foramen ovale because of its oval shape. And the foramen ovale, it gives passage to four structures, which we usually remember with the mnemonic MALE, M-A-L-E. M stands for the mandibular nerve, which goes out of this foramen ovale. A is for accessory meningeal artery, which comes into the cranial cavity through this foramen ovale. L is lesser petrosal nerve, which again goes out to relay in otic ganglion. And E is emissary vein, the emissary vein, which is also passing through this foramen ovale. So foramen ovale, four structures: male, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. And then just posterior lateral to foramen ovale, you have another small foramen here called as foramen spinosum. We call it foramen spinal. It's very close to the spine of the sphenoid when you see it from the base of skull. We call it foramen spinosum. And the major neurovascular structure supplying the dura mater are passing through it, like the middle meningeal artery. Now you can even appreciate the groove for the middle meningeal artery. Look at this, is a groove here for the middle meningeal artery. So middle meningeal vessels will come out of it, okay, will come in to the cranial cavity through it, in fact. And nervus spinosus, which is also called as a recurrent meningeal branch of mandibular nerve. We just said mandibular nerve will go out of the foramen ovale. This is the foramen ovale. And as soon as the mandibular nerve goes out of foramen ovale, it gives a branch which comes back through this foramen, that is foramen spinosum, to supply the dura mater, and that is called as nervus spinosus, also called as recurrent meningeal branch of mandibular nerve. Then between the body of the sphenoid and this petrous temporal bone and the greater wing of sphenoid, now you can see there's another foramen present here. This is called as foramen lesserum. Well, this foramen in living, from the inferior aspect, it is usually covered with a fibrocartilage. And foramen lesserum, it's basically not a foramen present inside any bone. It's kind of space left between the bones. Like it is a space between the sphenoid and the greater wing of the sphenoid and the petrous temporal bone. So that is foramen lesserum here. And on the side of this sella turcica, over foramen lesserum, we have the placement of the cavernous sinus. We'll talk more about it in the cavernous sinus when we'll discuss that. So this foramen lacerum basically is in the floor of the cavernous sinus. The cavernous sinus is the largest sinus, which is stretching from the superior orbital fissure to the apex of this petrous temporal bone, like this. So this foramen lacerum is in the floor. Let me take you to this part here. This is the petrous part of the temporal bone. Now there are a few important things to be noticed in this. Close to the apex of the petrous part of temporal bone. Now you can very clearly appreciate a shallow depression here, and this depression is basically to hold the trigeminal ganglion. So this is the groove which will hold the dural cave, which is also called as a Meckel's cave, for the trigeminal ganglion. And see, it makes sense. If this is the trigeminal ganglion, so giving passage to trigeminal nerve, so ophthalmic nerve will go straight like this into the superior orbital fissure. Maxillary nerve will go like this into this foramen rotundum that you can see here. That is foramen rotundum. And mandibular nerve from this obviously will go into the foramen ovate. So that's the placement or the positioning of the trigeminal ganglion in this cave here. That's a trigeminal impression. Another thing to note about the petrous part of temporal bone, if you look at the superior border of the petrous part of temporal bone, it is grooved by the superior petrosal sinus. It is one of the outflowing channel of cavernous sinus. The cavernous sinus will drain its blood backward into the transverse sinus through this one, that is the superior petrosal sinus. So that's a groove here representing, that's a groove for the superior petrosal sinus. Also, if you look at foramen lacerum, just lateral to foramen lacerum, I need to enlarge this thing for you. Just lateral to foramen lacerum, we have a groove here. Now look at this. That's a groove, or that's the hiatus for the greater petrosal nerve. Now greater petrosal nerve is a branch of facial nerve, and this parasympathetic branch of facial nerve will go through this groove. That is the groove for greater petrosal nerve, and you can see it is clearly going toward the foramen lacerum only. Whereas even more lateral, if I go even more lateral, we have another groove here, and that is the groove or the hiatus for lesser petrosal nerve, which is a parasympathetic branch of glossopharyngeal nerve. And this lesser petrosal nerve, we already said, will obviously go out of what foramen? That is foramen ovate. So we got a groove for the greater petrosal, and lateral to it we have the groove for the lesser petrosal nerve. Both are parasympathetic nerve, one coming from facial and one coming from glossopharyngeal, more precisely from the tympanic plexus formed by glossopharyngeal nerve. What else we can see more laterally here, that if you look at this elevation, guys, this elevation is called as arcuate eminence, and this arcuate eminence in the temporal bone only is actually because of the superior semicircular canal which is present deep to it. So this, I can say, this region is representing that we got an internal ear present deep inside. So that superior semicircular canal produces this elevation that is called as arcuate eminence. That is the arcuate eminence. More laterally and anteriorly, we have this tegmen tympani. We'll talk more about this tegmen tympani from the base of the skull, where it is also forming a part of the auditory tube. It contributes to the formation of the auditory tube as well. So that is the tegmen tympani. So this is about the middle cranial fossa. If I just give a quick recap of that. So we said this here is these are the optic canal which are present just inferior medial to the anterior clinoid process. We got this tubercle here called as tubercular sellae. This is dorsum sellae. In between we have this hypophyseal fossa or the pituitary fossa, also called as sella turcica. On the either side, we have the placement of the cavernous sinus, and in the floor of that cavernous sinus will be this foramen lacerum. That is foramen lacerum. We got a petrous part of temporal bone here. We got a greater mingus sphenoid more anteriorly, and then laterally we have this, the squamous part of temporal bone. Now, once again, let me tilt it for you to show you the superior orbital fissure. Then we have this foramen rotundum, we got foramen ovale, and then we have foramen spinosum, all three present in the greater wing of the sphenoid. The impression for the trigeminal ganglion or the Meckel's cave. We got a groove for the greater petrosal nerve. We got a groove for the lesser petrosal nerve, which is more lateral. We got an arcuate eminence formed by the superior semicircular canal, and then we have tegment tympani, part of the temporal bone itself. So that is about the middle cranial fossa. Now let's talk about the posterior cranial fossa. Once again, the bones which are contributing to posterior cranial fossa includes the petrous part of temporal bone, especially this posterior surface of petrous part of temporal bone. The body of the sphenoid, the posterior surface of the body of the sphenoid, including this dorsum sellae. The occipital bone with the squamous part of occipital bone as well. And if you see more laterally, apart from petrous temporal bone and the squamous part of occipital bone, we also have the mastoid angle of parietal bone as well. That's a parietal bone in this region, and there is a mastoid angle of parietal bone which is also contributing to the posterior cranial fossa. So starting with the features in the midline, well, this slope which you can very well appreciate here, this is extending right from this dorsum sellae to the margin of foramen magnum. It is found by the posterior surface of the body of the sphenoid and also by the basilar part of occipital bone. This is called as clivus. This is the clivus which is found by the posterior part of the body of sphenoid, and this here is the basilar part of occipital bone. And this is the region where the brainstem is lying on, the brainstem is present against it. And we also have basilar venous plexus which is related to this area, the basilar venous plexus. If you look at foramen magnum in the midline, clearly it's the largest foramen of the skull. And foramen magnum, it looks more or less oval, but in the anterior part it looks narrow. The reason it looks narrow in the anterior part because of the condyle, occipital condyle, which you can appreciate better from this, the basalis view. Now look at these occipital condyles, and because of these occipital condyles, the anterior margin of the foramen magnum looks narrow than the posterior part. And if I just tilt this skull slightly and show you a canal which is present in just above this condyles, these occipital condyles. Now that is called as anterior condylar canal, or you can better call it hypoglossal canal because it gives passage to the hypoglossal nerve. That is anterior condylar canal or hypoglossal canal. Let's again go back inside the cranial cavity. So we said we got this foramen magnum, which is slightly, which looks a bit, smaller in size from the anterior aspect because of these condyles, occipital condyles, and we have anterior condylar canal or hypoglossal canal giving passage to hypoglossal nerve. And similarly, if I once again just turn the skull and show you a canal which is present behind the occipital condyle, these. Now these canals which are present behind the occipital bone, this is called as posterior condylar canal. That was an anterior condylar canal, and this is called as a posterior. We can simply call it condylar canal also. When you just say condylar canal, we are talking about the posterior condylar canal. Anterior one we have to say anterior because that is also referred as hypoglossal canal. What else we can appreciate in this posterior part of the cranial cavity? Now, this here is the internal occipital protuberance, which is exactly opposite to the external occipital protuberance, which we'll discuss in the norma occipitalis. And then sloping from this internal occipital protuberance, this is internal occipital crest. And when you trace this internal occipital crest toward the foramen magnum, you can see this triangular depression here, which is called as the Wormian fossa. This is a Wormian fossa. As the name suggests, it is the vermis of the cerebellum. The vermis of the cerebellum, which is resting here. That is Wormian fossa. This triangular region is the Wormian fossa. From the internal occipital crest, you can also appreciate the two sulcus here, the transverse sulcus. There is a left transverse sulcus and there is a right transverse sulcus. And usually this right transverse sulcus is wider than the left, which we can very clearly see in this skull also. That this is a broader sulcus here, this one, and that's a narrower one. Because this right transverse sulcus is actually continuation of the superior sagittal sulcus. Superior sagittal sinus running in superior sagittal sulcus will continue and goes toward the right side. That is a right transverse sinus present in this right transverse sulcus. And if I run with this, the transverse sulcus, it leads into another sulcus which you can see over there present in the occipital bone, that is called as a sigmoid sulcus. Look at the shape, that is a sigmoid sulcus holding the sigmoid sinus inside, and that sigmoid sulcus in the lower part is reaching this jugular foramen. Reaching the jugular foramen. Now, look at this jugular foramen other way around. We said this is the clivus part, right? This is the clivus here, and this we already discussed, the petrous part of temporal bone. So between them we have a fissure here. That is also called as a petro-occipital fissure. That is a petrous bone and that is the occipital bone. So we call it a petro-occipital fissure. If you remember, we said upper border of the petrous temporal bone, we have superior petrosal sinus running in it. So obviously we have an inferior petrosal sinus running in this fissure and then goes in the anterior margin of this jugular foramen. So when we talk about the contents of the jugular foramen, the content that you'll see most anterior-medially here, that will be the inferior petrosal sinus. Most posterior lateral content will be the sigmoid sulcus, that is sigmoid sulcus, which will be here. And in between, we have the three cranial nerve present, that is 9th, 10th and 11th cranial nerve. 9th, 10th and 11th cranial nerve, the glossopharyngeal, the vagus and the accessory nerve, both spinal and cranial accessory nerve, will be seen in this jugular foramen. Please also note that on the petrous temporal bone here, on the petrous temporal bone, on the posterior surface, you have this transversely placed opening, that is internal auditory canal or internal acoustic meatus. This is more or less horizontally placed, and this internal acoustic canal, which gives passage to the 7th nerve, to the 8th nerve, and also to the labyrinthine artery. Give passage to 7th nerve, 8th nerve and labyrinthine artery. This internal acoustic canal, when it goes laterally inside and it communicates to the towards the internal ear, it is actually separated from the internal ear by a cribriform kind of plate that is called as lamina cribrosa. Lamina cribrosa. So it is basically separated from the internal ear by this perforated plate, or you can say cribriform type of plate, which is called as lamina cribrosa, this internal auditory canal. The two big fossa that you can see on the either side, that is the cerebellar fossa, clearly for the placement of the cerebellar hemisphere here. These are the cerebellar fossa. Well, we've discussed the foramen magnum and its content from the norma basilis. But regarding the attachment, now the 2-3 important attachment you should know in the posterior cranial fossa. that first of all, the posterior clinoid process which are present along this dorsum sellae, they give attachment to the attached margin of tentorium cerebelli. Now remember, we said anterior clinoid process will give attachment to the free margin of tentorium cerebelli, and the attached margin of tentorium cerebelli, which is present like this in this region, that attached margin of tentorium cerebelli will be attached to this posterior clinoid process. Secondly, when we go along the clivus in the lower part, somewhere here in this region, it gives attachment to the apical ligament of dens, to the vertical band of the cruciate ligament, which is also the ligament supporting the dens, and also to membrana tectoria. That is all along the margin of the foramen magnum in the lower part of the clivus. So we have a membrana tectoria attached to it. Membrana tectoria is nothing but the continuation of posterior longitudinal ligament, apical ligament as well as the cruciate ligament, especially the vertical band of cruciate ligament is also attached in this region here. So let's have a very quick recap on this. So we said the posterior cranial fossa, the bones contributing, we got a sphenoid bone, we got occipital bone. This is the squamous part of the occipital bone here, the petrous part of temporal bone, and we can also see the mastoid angle of the parietal bone, Important foramina here, we have the internal acoustic canal in the posterior margin of, or the posterior surface I should say, of the petrous temporal bone. Below that we have a jugular foramen, and you can see the two kind of sulcus which are leading toward the jugular foramen. One is this fissure which is called as the petro-occipital fissure, where you will find the inferior petrosal sinus, and that is a sigmoid sulcus which is leading into the posterior lateral margin of the jugular foramen. If this is a sigmoid sulcus, this here is the transverse sulcus, right? And as we already said, the right transverse sulcus is larger than the left one, because this right transverse sulcus, which is having the right transverse sinus, will continue with the superior sagittal sinus. You can see that. It's very clear in this skull. You can see this sulcus continuing toward the right side. That is internal occipital protuberance. Here we have internal occipital crest, and in the lower part, this triangular fossa that is called as Wormian fossa, which is related to the vermis of the cerebellum. So that is all about the cranial cavity. These are the important attachment and the foramina we should know about. So in the next section, we'll talk about the other part of the skull bone. We'll look into the orbit and the bones which are contributing to the different walls of the orbit. Thanks for watching.